Thank you all for coming out this afternoon. It was important for me to come out and see firsthand the incredible work that's being done all over the state of New York, but particularly here in Albany County. And I can never thank the staff and the healthcare workers and the Department of Health individuals and the volunteers and the National Guard who are making all this happen. And they've been here at Crossgates since last April. They probably didn't think there'd be such a huge spike in demand. They couldn't have possibly foreseen that there would be a new variant that would really change the trajectory of this crisis, but also that they are continuing to show up every single day. They bring heart and passion, and I had a chance to thank them individually. There's literally 60 individuals who come here every single day, 10 incident commanders, and I want to thank them as well for the great work they do. Rob Valenti just gave us the tour. He made sure that we had a chance to meet the individuals who have been vaccinated, those who are boosted, and I have to tell you, if you have a chance to see that waiting room, there is an energy and an excitement among the individuals who now know that they're going to be able to celebrate the holidays, celebrate Christmas dinner with their loved ones without risk of getting sick, because most of the people in that room were getting their booster shots. And that's the extra fortitude that they need to make sure that they're safe, as well as wearing masks as well. So it was a personally uplifting experience for me to see that so many people are answering our call to do the right thing. Even in these final weeks of December, there's still time to do what's right, to protect yourselves, and always think about the most vulnerable person who's at your dinner table. Are they going to be safe if you don't get vaccinated? And you need to make sure that you are vaccinated, boosted, and encourage people to still gather for the holidays, but also make sure that you're protected and you look out for those individuals. So I had a chance to stop by and thank the workers. I brought some cider belly donuts, which were a big hit. I did that because I also want to thank that company, as well as many other businesses, for doing the right thing, to making sure that people are wearing masks or that they have vaccination rules in place. And so many businesses who are the unsung heroes of this pandemic, doing the right thing every single day. And I'm so grateful to them, as well as the customers and the employees who are following all of our guidelines. We have seen a sharp increase in cases over the last week. This was not surprising once we knew Omicron had hit the shores of this country as well as New York State. We knew this was going to just be a matter of time before something that spread so exponentially would increase dramatically. So we had a big increase in numbers, 21,000 just yesterday. But also, we also know that this is a milder form of the variant than Delta had been. We're still waiting more science and data, but that is a very positive sign to let people know that if you're vaccinated and boosted, you are more likely just to have either asymptomatic or just have very minor symptoms, and that's important to know, because the reason we want to make sure that that occurs is we watch the hospitalization rates intensely. This is what I have been concerned about literally for months, and we saw Omicron coming and how fast it spread. We knew we had to do one thing more important than anything: make sure that our hospitals could handle any surge in new patients coming in the door. And what we've seen, that the hospitalizations and our capacity to handle them are holding steady. I'm not going to make a prediction of what could happen a week from now, because we've had this is rapidly changing, but because of the precautions we put in place, limiting in some cases where there's less than 10% bed capacity, limiting elective surgeries in those facilities, that we are making progress. And so what we have now is a couple weeks ago, we had 32 facilities that had to suspend those elective surgeries. That is now at 28, that individuals are coming off that list because the bed capacity is something they can handle. We also know that compared to last year, let's just frame this in terms of where we were 1 year ago. We had hospitalizations are 60% of what they were during last winter's surge. We have 3,900 people hospitalized right now. 1 year ago, we had 6,200. So that, again, is an indicator that this variant is not as severe as last year, and also the steps we took to make sure more people are vaccinated and boosted. There's fewer people going into the hospitals, as well as I want to thank the hospitals for standing on guard and being ready and following our directives to make sure that there's no situation where we end up with a crisis situation, but we're vigilant. Again, we are on this every single day, making sure that we send the National Guard in to help relieve some of the pressure in our hospitals and our nursing homes. Making sure that our healthcare workers are vaccinated, something that was considered very controversial a few months ago, As it turns out, it was absolutely the right thing to do, because I just met a couple of individuals now who are getting their vaccine for the first time. One of them said they're doing it because they work for me. I said, that's good. I want to thank them for all the workers and individuals who, even at this later date, are doing the right thing to keep people safe. I mentioned the booster shots. We have 93.9% of New Yorkers are vaccinated with at least one dose, but the increase in boosters is going up. We had over 100,000 people being boosted every single day. That's a lot of people getting those booster shots, many of whom are sitting right behind these walls. Making sure we have capacity. We announced that 40 new vac sites are opening. Now, a year ago, again, let me reframe this. All we had when this started a year ago and the vaccines were starting to become available, we only had the mass vac sites because there was a limited supply of vaccines, and there was no even talk about boosters. We now have our sites ramped up. We have 40 new sites, but this is in addition to what is happening all over this state, where we have 4,500 pharmacies and doctors' offices that also have supply. So what you see at a vac site is not the only place that people are receiving their vaccines and their boosters. We're continuing to do robocalls, making sure that people only had that one dose, that they will get that second dose and get the booster. So we're doing outreach constantly. We have Dr. Bassett out there talking about this on the news. She'll be doing a robocall to people as well. I believe that people will trust her voice as well, as someone who is an expert in medical matters, and someone I've come to trust as well. So we have more people getting boosted. Great news. We're stabilized in hospital capacity, at least for today. That's important to note this. And we're going to continue making sure that we have all the resources we need at our disposal. Let me repeat. This is not March of 2020. We have defenses. We have people across the state of New York who are doing the right thing. And I thank them for making sure that this holiday season is vastly different than last year. We want people to reconnect with their families, so critically important emotionally, and for particularly our older residents, people who've been suffering from isolation during most of this. We need those connections, and there is a very, very, very safe way to do it, and that's what we've been talking about, which is simply getting people boosted and continuing to wear the mask. So we're going to get this done. Testing, you see pictures in some communities, long lines, New York City. That is actually a sign that people are doing the right thing. We are working hard to increase our capacity. We've been talking about this from the beginning. We'll be embedding more testing opportunities and even having test kits available when our supply is refurbished at our vaccination sites. That's important. So we now have 1 million test kits that I ordered a couple weeks ago. They have arrived. They've been distributed to local health departments. We have another million coming in a few days, another million coming after that. So we're going to continue increasing our supply. So a lot of tests. We did 1.2 million tests a week. And just comparing again, last year to this year. 1 year ago today, we did 190,000 tests. Yesterday, we did 290,000, nearly 300,000 people across the state of New York. And so we're also going to be launching a portal so people can order them. We can make it even easier, and also dealing with the manufacturers and our pharmacies to make sure there's plenty of supply on the shelves. So we're literally pulling every lever possible to make sure that we protect not just the health of our people, which is my number one priority, but also protect the health of the economy. Why that's so important? We saw what happened last year when there were shutdowns and businesses and hotels and restaurants and culturals and attractions, that some of them which never ever came back. And that is so sad for those communities, because the small businesses in particular, places like upstate, Albany, Schenectady, Troy, all the great communities we have in upstate New York, they're defined by these businesses. That's their character, that's their personality. And when they leave, your favorite brewery, your favorite winery, your favorite restaurant, there's a hole in the heart of the community. I'm working so hard to prevent that. I want those businesses to not just survive, I want them to thrive. So I encourage everyone, you can also not just help your loved ones and make sure that grandma's at the dinner table with you again next year, and elderly parents and people you just care so much about. You can take steps to protect them, but at the same time, you're also protecting your local businesses and your local community, and I thank all of those who follow this. So more tests are on the way. Albany County, I want to thank our leader here, Dan McCoy. He is someone you want to be in a foxhole with during a crisis. He's been our partner from the very beginning, doing everything he can to make sure that our sites are staffed, to make sure that we have a local partnership, which is so important to me. So County Executive McCoy, I thank you. Also our local government officials, Guilderland Town Supervisor Peter Barber has joined me. I spent 14 years in local government. I know that's where the rubber meets the road, and I want to thank our supervisor for also all he has done to make sure the word gets out, and also make sure our businesses know that we have their back. Everything we've put in place is to make sure that they do not have to face a shutdown, and that's why we are encouraging everyone to follow our requirements of vaccinations or testing or masks at various locations. Again, I want to commend the incredible team that's here today, and I want to just give them a round of applause. Everybody should turn around and thank them for what they do. Rob Valenti and the Department of Health's lead, Jennifer Unser. Jennifer, where are you? Jennifer, thank you. Jennifer, this is extraordinary. Please give our gratitude to everyone who's part of your team, as well as the National Guard, who are always there to help the people of this state, called from the security of their own homes and their own jobs, and willing to sacrifice their weekends, their evenings, and even their holidays. So to our National Guard, I am so grateful for all you do. So with that, I'll be happy to take some questions. And
yeah. Governor, you just said local government is where the rubber meets the road, right? Given all the opposition that we've seen from Democratic and Republicans alike at the county level to your new mask executive order, to what extent are you leaning on local officials in those areas to push compliance?
I'm asking everyone to be part of this solution, and this is really a solution to help keep us safe during a very, very vulnerable time. You only have to see what happened in places like South Africa and England and other parts of this country that were literally overwhelmed and swamped with cases, and exponentially means while the vast majority of people who are sick may not be needing hospitalization, but when you have so many more people infected, statistically you're going to have more people in hospitals, and that's what we're fighting at. So I just want to say to all the businesses, the individuals, their employees, their patrons who are following what we ask, as well as the local leaders who took the same oath of office I did to protect their citizens, I just want to thank them. And because of them, and those are the majority of individuals in the state, they're not the ones getting the credit that they deserve right now, and I thank them for following what they've been asked to do.
But to be sure, have you contacted any local village, town, lower officials in, say, like some of these Long Island counties, for example, where officials are still working?
Well, it's up to the individual businesses, and I'm encouraging relationships. We have talked to every level of government. We are in contact with the Association of Counties. I talk to county leaders and it is their public health departments that are on the front lines of this, but also certainly our local mayors and our supervisors. They have a role to play too, to go in and show physical support for these local businesses that are doing the right thing, and that's what they can do. They can use their position and get the local media to put a spotlight on the people who are doing the right thing, which is literally why I brought donuts from a place that's doing the right thing. We need to show them that they're the ones that are protecting the health of the community as well, and I'm grateful for that.
Kind of bouncing off this question, Governor, there's a bunch of capital region counties like Rensselaer, Saratoga that aren't adopting the state mask mandate. Is there going to be like a hard push if we're seeing an influx of positive cases?
I can't, there's a little noise in the back. Is there going to be what?
There's a bunch of capital region
Right.
counties that aren't adopting the state mask mandate, like Rensselaer and Saratoga. Is there going to be a harder push if we're seeing an influx of cases come in to adopt, to have everyone wear a mask?
I have tremendous respect for elected officials across the state. I've served in county government, I've served in local government. And what I would say to them is they must be seeing the same thing we are. They are seeing a huge spike in cases. These are their constituents who possibly could end up in a hospital, but would have to leave work or leave school because they're sick. And I think at some point they may come to the same realization that wearing a mask is about as simple of a request as you can ask for. This is such a minor intrusion. A major intrusion is saying, we've shut down your businesses. You cannot go shopping for Christmas. You cannot take your family out to dinner. You cannot go bowling. You cannot get a haircut. Okay, that's an intrusion. We already went through that. This is not 2020. That's not necessary as long as people continue to follow the very basic steps, wearing a mask, getting vaccinated, booster, and we'll get through this. I have so much confidence in New Yorkers that we can lead the nation in terms of being the state that started here first but we're the ones that were the first to say it's over. And we may always have cases that spike up, but as long as we're boosted and we're masked, we're going to be fine. I want this economy to thrive. I want to come back. I don't want to see any shutdowns. And those local officials have a responsibility to make sure that they're also protecting the health of their local economy, as I'm trying to do. So I'm welcoming more to be partners in this effort.
Do one or two more questions?
Governor, you had mentioned yesterday on the King Church show, talking about vaccine mandates for schools coming next year. Can you kind of touch on that a little bit?
Right, this is certainly something that public health departments all across the country are looking at, and it requires a legislative action to have this come into play. Every single vaccine that children have to have before they can go to school has to be authorized by state law. Not every state follows this. I spoke to the governor of California. He has this in place for next fall. He did not have to go to the legislature, but the way it's constituted in New York, we do. So I'll be having those conversations. Everybody has to have a vaccine before they can even enter kindergarten. I just spoke to some children out there. I said, you've already done this. Don't be nervous. You've already done this before. You're going to be okay. And that's how we want to just diffuse this situation, just put it on the list of the other vaccines that are required. So we'll start getting the word out about that, but there's not enough time for this upcoming semester because of the requirement of getting it approved by the legislature. One more question? Anybody we haven't heard from? You good? Okay.
Totally different topic, medical aid and dying that's billed before the legislature would allow terminally ill patients to take their own life if they would otherwise die within 6 months. What is your personal opinion about this idea?
My personal opinions do not have a place in public policy. I will be listening to both sides of the debate, but it also has to originate in the legislature. And I think all of you who followed me, my press conferences, know that I don't negotiate legislation in a forum like this. I know how to get things done. I'm working on my State of the State address, which is going to be very forward-thinking and is going to have a lot of initiatives to help everyday New Yorkers who've been suffering. And certainly issues like that are very important, and I'm willing to have those conversations at the right time. So thank you, everybody. Appreciate you coming out.